Hey guys, this is Alex, and this is my first YouTube video. I am a 46-year-old trans guy, just turned 46 in December. I just decided or realized that I needed to transition and that I wanted to transition about May or June of last year, maybe first part of July, somewhere in there. When it happened, I was not in a very, I wasn't in a very good spot there for a while. I was a problem with depression, that type of thing. Seems like we all have that issue. But when I realized why I wasn't happy and had been unhappy so much of my life, it was like I just had this epiphany, and it was like this fake person that had been standing on me all these years just stepped off. And I felt so free and so me for the first time. It was like I actually knew who I was supposed to be. And it was an amazing feeling. So right away I went ahead and I started, because I didn't want to procrastinate on this. I don't want to say wasted, but it felt like I'd wasted so many years of my life trying to be someone I wasn't, that I just couldn't wait anymore. So I told my family, and it was amazing. The support that my family gave me in everything, and they continue to do so every day. My oldest brother, who passed away at the end of July, his comment to me was his one regret was he wasn't going to be able to be around to see the final result. So, my family response has been awesome. The only negative I've gotten was from my youngest brother, his family, but they're not actually family to me. They're just relatives. Some of us, we share the same name, we have the same blood, but that's about it. We don't interact with each other. We aren't a part of each other's lives, and I'm okay with that. I have the rest of my family, and they support me. They want me to be happy, so that's what I'm doing. When I told the people I work with, they've all been just so great. My coworkers are great. The company I work for, they actually have gender identity as a protected status in their anti-discrimination policy. The director of my area, his response was, "This is really great. The company needs more diversity. If there's anything we can do, let us know, and we'll help you any way we can." So that was really great. I haven't, I hear so many guys where they talk about where their family turns away from them, or they just, they lose friends, they've lost their jobs, and I haven't experienced any of that. I'm very, very lucky in that aspect, and I count that blessing every day. And I've been wanting to do a video for a while, and I've just been putting it off, and due to some recent events in my life, I decided that I couldn't do it anymore. I couldn't put this off. As I said, I had surgery just about 2 months ago. Got the plumbing taken care of. Feeling so much better now that that's gone. There was a health issue with that, so that just kind of fell into line with the transition. So that was really good. One of the things that really prompted me today was I watched a video from a guy who was talking about some of the negative effects of testosterone. Now, I don't know where a lot of you are in your transition. Transition is such an individual thing. Some of you may decide that you just want to present as male. Some of you may want to do the hormones. Some of you may want to do hormones and surgery. Some of you just want to do surgery. You have the top surgery, the bottom surgery. Maybe you get the top done and not the bottom. It's transition. It's like everything else. It's so individual to each one of us. And I feel like a lot of you guys out there, you're like my little brothers, and I feel like I need to be here. Not saying that that I have some special insight into the whole process, but sometimes we just need that older person to talk to. We'll just put it that way. But the one thing that really prompted me this morning, that I was watching a video and the guy was talking about, some of the negative effects of testosterone that we don't always necessarily talk about. Now, I've been fighting with my endocrinologist. I don't want to say fighting. It took my therapist a little while to get the letter in, which there was issues with like her fax machine and stuff like that. To get the letter in, that one, for me to even get the appointment with him, and then for me to get approval for hormone treatment. So he gave me a prescription, and of course he wants to go with the gel. I know my insurance is going to cover the gel. I wanted to do the shots because most everybody I've seen, the guys are all talking about, they do the shots, and it's because it's so much cheaper. The shots I can afford out of pocket. The gel I can't. I mean, the cheaper gel that my insurance is trying to get him to go with instead of what he prescribed, cash price is still over $700. So I don't see my insurance paying the bulk of that, so that I may have a $30 or $40 a month prescription. I don't see that happening. So I'm hoping that maybe next week I can get a hold of him, and we can figure out what we're going to do with this, and we can get on with the other stuff. What I've done in the meantime is, a friend of mine, her husband suffers from low T, and he didn't like the gel because his wife couldn't touch him. He had to be careful where he applied it because his wife couldn't touch him. So he actually went to the vitamin store and got a testosterone booster. Granted, it's not going to do the same thing for me that it does for him, but at least it gave me the feeling that I was taking that step forward, that I was moving forward in this process. Because we all feel that way at times. It's like, once you decide, you just want things now, and it takes time, and it gets so frustrating, because I don't know if you guys feel this way or not, but I do. It's like, even these professionals that specialize in this or deal with trans all the time, it's like they don't. Sometimes I just wonder if they truly, truly understand the mental aspect and the strain that we are under, trying to be who we are, wanting to be who we are so badly that you can taste it every moment of every day, and the frustration of, oh, well, we're going to try, no, well, having to fight with the insurance and and it's just, it's taxing, to say the least. And as I was saying, I had surgery back at the end of November, and in my pre-surgery checkup, my doctor found a nodule on my thyroid. They did blood work up. Everything showed it was working normal, so they waited until after my surgery to do the ultrasound on it. Well, the ultrasound came back with a 4-centimeter nodule. Normally, it's not that big a deal. Everybody gets them. Normally, though, they only go to maybe 1, maybe 2 centimeters tops. Well, this one was 4. So they decided they needed to do a biopsy. They did a needle aspiration and a core biopsy. The core biopsy came back with papillary cancer. And when I was watching the video this morning about the negative side effects of tea, that was one of the things they talked about, was the increased cancer risk. And just a little family history here. My immediate family, there were 6 of us, 4 of us kids and our parents. I have lost both of my parents and both of my brothers to some form of cancer. I've also lost a grandfather to cancer, several uncles and cousins on my mom's side. On my dad's side, not only did, his dad die with it, his mother had it, his brother has it, his sister had it, her daughter had it. So it's really prevalent in my family. And then, like I said, I saw that, and then I got this diagnosis with this papillary cancer, which the doctors are saying, if you have to get it, this is the best kind to get because it's got a 99% cure rate. Basically they go in, they take your thyroid out, and so you can still see the marks where I had the biopsy done over here. They take the thyroid out. You go through a round of radioactive iodine treatments. They put you on thyroid medication for the rest of your life, and you go back every so often and get tested. And when I told my sister about the diagnosis with my thyroid, it kind of scared her a little bit, especially like I said, with wanting to transition, and then also knowing that the fact that cancer is, it is an increased risk for us. But the way I look at it, I would rather go on T, be who I am, be the person that I am, and only live maybe 10, 15 years, as opposed to living and being this facade of what people see now, people that don't know me, what they see, and live another 30 or 40 years and be miserable. So, it's not going to stop me from proceeding with what I want to do. But I've been listening to some of the younger guys, and I feel your pain. I hear the anguish in your voice, and I felt like I needed to say something to let you guys know. I mean, I know there's a ton of these videos out here, but just to let you know, it's going to be okay. We're in this together. Any of us that do these videos, we're all here. We're all here for support. So if anybody watching this, if there's anything I can do, feel free to contact me. I'm here. I'll listen, even if you need a shoulder just to vent on. If you want to scream and rant and rave, that's fine. We all get like that. I'm here for you. I want to be like a big brother to you guys. And I think that's important. Another thing that sounds kind of hokey, but it is important, is if you can find a good support group. My girlfriend, who I was not dating before I decided to transition, we were actually introduced by mutual friends, and I told them I wanted to make sure that, she knew everything that was going on and she was okay with this, because I didn't want to meet somebody and, fall in love and all of that, and then have them throughout the process say, what, I can't do this. I'm sorry, I can't do this. So she's really great. She's on board. She supports everything I want to do. She's by my side. And it was actually because of her that I actually went out and found a support group, because I'm like, what, I don't need one. I'm okay. But you do. You do need that. Sorry, the dog was making a noise. Granted, so far everybody in my group that I've met are all MTFs, but there's still a lot that they go through that we all go through the same thing. The whole family, deciding to change, the hormones, the waiting. It's a lot for all of us. And don't be afraid to reach out and talk to them. Like I said, the support group is almost it's essential. It's almost as essential as the surgeries and the hormone therapy and everything. It's really, really important, and it does make a difference. It really, really does. I don't know. I'm kind of running out of steam. There was so much stuff that I wanted to say, but I'm just kind of running out a little bit of steam here, and I just want you guys to know that if you need something, I'm here. Don't feel free to reach out to any of us on these videos that you see, because we're all here to help. We're all wanting to be something to somebody. If we can't support each other, nobody else is going to do it. So this is important. I hope to make some more videos soon. If you guys have any questions, please don't be afraid to ask. You're not going to offend me if you ask an honest question. So, like I said, my name's Alex, and I look forward to talking to you guys again soon. Bye.